Okay, hello, this is Joe Nimzora again. And I thought I'd do a part 2 to the Nurse's Pocket Guide video that I posted the other day. That one was 16 minutes long, and it just talked about what was in the blue index. And it also went over the idea that when your faculty is checking your care plan, and you have chosen a nursing diagnosis, they go back to make sure that you have documented the defining characteristics of that diagnosis, which is actually a key point. When you learn that, when you truly grasp it, then you'll know how to submit a care plan that always passes. Because what you see in the database, the first few pages of your care plan where it says go over this or that body system, has to be used as the basis of the nursing care plan diagnoses choices that you make. Every nursing diagnosis has to be supported by one of two things. Either something you saw when you examined the person, or else something that the person said to you, preferably in quotes. Think about that. But in the meantime, I wanted to go back over and actually highlight some very specific things in the blue index that I think will help you guys. And I tried to put little post-it notes in here to help me as to which ones we were going to do, because I do think this is actually worth going over again. And particularly at Plant City, where one of the things that for us is we go to the renal ward at, where is it? The renal ward at Lakeland Regional Medical Center. And before you even go to the renal ward, it's actually really worthwhile for you to find the nursing diagnoses that are based on kidney failure, i.e. the renal things. This is the older edition, but what we have here is, if you go to the blue index, it says renal failure acute. And it says excess fluid volume, risk for imbalanced nutrition, risk for infection, risk for acute confusion as the nursing diagnoses. And then in the smaller print after the underlined letters, it actually says a list of the things that are the defining characteristics. So to reiterate from the other day, when you know the medical diagnosis, you look up the medical diagnosis in the Nurse's Pocket Guide. Then you come to this list, and then this list gives you the possible nursing diagnoses, and it actually tells you some very specific things that go with each nursing diagnoses. And then after that, if you're smart, then you will take that list of things that go with that nursing diagnosis and to see if your patient actually has them. If they've got them, then that's a nursing diagnosis that you can pick. We actually don't want every single person to pick pain, ineffective breathing pattern, or altered skin integrity every single time, because then you get good with a half a dozen of the average diagnoses, but then you don't sharpen your assessment skills to look for the ones that might not quite be there. So particularly for Lakeland, that's one it's well worth actually reading beforehand. Then underneath it, they actually go into chronic renal failure. And it actually says risk for decreased cardiac output, risk for bleeding, risk for confusion, impaired skin integrity, and impaired oral mucous membranes, because those are also things that you need to check. There's actually 4 or 5 renal-related diagnoses here that are of interest to us. We don't, at our clinical site, we don't often get transplantation persons so we don't see them on our ward where we go. But that's one of the things that we would be looking for. The next thing to say is there is a nursing care, there is a diagnosis of people with chronic heart failure and decreased cardiac output, excess fluid volume, risk for impaired gas exchange, activity intolerance, risk for impaired skin integrity, and deficient knowledge. So this really helps you gather the entire list of possible nursing diagnoses most of the time. And then where else did I have? There was one other one I highlighted, which was general dialysis. We have a lot of people at the clinical site who are there partly because they still need dialysis, which they go to on a regular scale. So the thing about this one that's kind of interesting is it actually includes grieving, disturbed body image, self-care deficit, powerlessness, compromised family coping, and imbalanced nutrition. And so that's part of the thing. And then right below it is something about peritoneal dialysis, which you never even thought of that was a thing, but it is. So that's kind of what I wanted to talk about today in this one and kind of go in more detail. Here's another way that you do it. You get report in the morning on 4 or 5 patients. Learn the diagnosis for each one. Then you hurry back here to the book. Quickly look this up as the guide for what to check. And then when you go and do your head-to-toe assessment, you've got a head start on what you think is important. Here's a tip about head-to-toe assessment. There's one way to do it is to assume that you know nothing about the person and that you're going to start from scratch and discover everything. Who are you fooling? You're a beginner. That would be an unrealistic expectation for even an advanced beginner or an RN that had only been out of school a short time. Sometimes that's not even a realistic expectation from them. You need every head start you can find before you go in the room. That's why we talk to the night nurse and write it down and take notes. And that's where this book also comes in. You end up memorizing. We're talking about nursing diagnosis here. You end up thinking about which one goes with the typical medical population you meet. And that's what this is to be used for. So that's kind of one of the things I wanted to say. Now, the other piece that I wanted to bring your attention is back to this card that comes with the textbook. And as I've said before, this card here, laminated, you can spill coffee on it and then it'll get washed off, is actually organized according to Gordon's functional health patterns, I believe. And there's a couple things in here that are particularly useful, not just for the head-to-toe assessment, but for when you are learning how to use communication principles, the so-called therapeutic communication. And I want to bring your attention to them. One category is social interaction. And this has got some there are great nurses. I mean, a lot of what we do is verbal interventions that say teaching or identifying the emotional state of the person. But social interaction is caregiver role strain, parental role conflict, all varieties of coping, family processes, parenting, social isolation, and everything. And just for kicks, one of these times you should go through them all and read what they mean by each of these things. If you've never actually thought about coping is dealing with the problems, and you have a big part of what we do is help the people how to cope with what's happening to them. I can't cure people. There's a lot of things that nobody can cure you of once you get. But what we can do is help you live with whatever it is better and deal with it and still have a happy life. And that's all about coping. I mean, that's like one of the things about nursing is we may not be able to tell the person what to do, but we can help them get the tools to think about what they want to do. And that's what this is all about. Then there's actually a whole section on teaching and learning. And in first semester of the program, teaching and learning is a lot of the theme, because teaching and learning is part of what's written into the Nurse Practice Act as to what nurses do. So the thing that happens from the beginning is a lot of people focus on this and they say, oh, I'm going to be dealing with learning the physiology of the disease process or the skills and get checked off in the skills lab or whatever. These are the soft skills related to when you interview the person, if you're paying really close attention to what they're saying and what they're up to, that lead to being able to help them cope. So that's kind of the guide there. I got Buddha in the background. And then the rest of these, many of these are more, how to put this? Many of these are more physiological. That's my message for today, is going over those. I think that's plenty, and I just want to thank you for watching this second one, and it's all about the Nurse's Pocket Guide.